So my name is Marina Gillette. I am a health science instructional technician. I help out with the first year students that are here, and I've been teaching the pharmacy tech program for the second year program. So my background is I worked as a nutritionist for WIC, which is Women, Infant, and Children. So I worked there for a couple years. I also taught at Stanford Brown College, and I went to medical school, and I did all my rotations at McLaren, Oakland, which is where our second year students are placed. I think the big advantage our students have with coming to our program is that they have a competitive edge when they're competing for any of the healthcare careers that they can apply to beyond here. They'll have had experience with patients, which few high school kids even have the experience to have, which will give them clinical hours, patient hours, which will make them more competitive when they are applying to nursing school, PT school, pharmacy school, medical school, any school that they choose to pursue. All our students here have the opportunity to job shadow even as a first year. Our first year program here, the students go to St. Joe's every Friday, and they rotate between the different departments there so they can get a glimpse of what real world medicine looks like in different roles. As the second year, that gets carried over to more time. They're out 2 days a week, and they get to experience more hours at the hospital, and they also do rotations but longer period. They're in each service for at least a month. And our pharmacy kids are out in pharmacies, and they're out 2 days a week working hand on hand with a pharmacist. We have the sports medicine kids. They're at physical therapy offices, so again, getting hands-on experience as well there. Our pharmacy kids, they will be able to sit for the pharmacy tech exam at the end of this, and if they pass, then they can, yes, get a job as a pharmacy tech student. The PCT program, they would be able to get a job as a patient care technician as well, and there's job postings every day at all the major hospitals in the area where they can get a job as a patient care technician. And our sports medicine kids, if they sit for the national exam, they have the opportunity to work in that arena as well. So we've had success stories in every building that teaches health science. We've had students that worked their way through nursing school, working as a CNA or a PCT while they're going to school. And once they get their nursing certificate, I've had students then go on and get their master's as well. So there's great stories. We have students that have gotten into med school as well. So this is just the first step into whatever career choice in healthcare they want to go into.